Winter is almost here, and pollution has already taken over some of the major cities. The next few months are not going to be easy, especially for small children. The big question is, are you prepared? Hello, everyone. We are back with another informative and interactive session at Parent Tune. I'm Zahira, and I will be hosting this workshop with expert pediatrician Dr. Nida Asif, where we will learn about some of the most common illnesses that can be seen in 1 to 3-year-olds in winters. The incidence of various respiratory illnesses tends to increase as there is a drop in temperature. In many cities, the bad air quality further aggravates the problem, thereby making it important for the parents to take proactive measures to protect their little ones. Upper respiratory infections like RSV, common cold, and sinusitis are on the rise, and so are more severe conditions like pneumonia. In today's session, Dr. Nida Asif will elaborate on the types, symptoms, causes, prevention, and management of such illnesses in toddlers. I would like to welcome Dr. Nida. Welcome, doctor.
Hi.
So, doctor, what are the most common respiratory conditions that affect babies in winters?
So in winter, most common conditions are respiratory illnesses. So in respiratory illnesses, you have upper respiratory illness and lower respiratory illness. So this is how we divide and understand. Upper respiratory illnesses is anything above the level of your throat. So you can have nose, which can cause runny nose. You can have sinuses, the sinusitis infection. Ears are affected, which causes otitis medias, and the throat can get affected, tonsils can get affected, so they can have tonsillitis, and there is this voice box present in the throat which is called as larynx, so that can cause laryngitis and epiglottitis. So these are the upper respiratory illnesses. And in lower respiratory, anything below the throat where the lungs are involved, if that is the case, then there can be bronchitis or bronchiolitis, which is commonly caused by RSV, and then pneumonia. So in pneumonia, the lungs are filled with purulent content. So these are the common illnesses. So all these are infective causes. So in non-infective causes, we have asthma also, which is seen, but in less than 3 years of age group, they can present with infection, and following which they can have wheeze. So these are the conditions which are there, is commonly seen in toddler age group.
Thank you so much, doctor. So, how does RSV differ from common cold? Is it more serious?
Yeah, so as I told you, anything which is there above the level of throat is called as common cold, and upper respiratory illnesses. So here you can see runny nose, voice change, sore throat, headache, and earache, nose block, and dry cough. These conditions, these symptoms, you can see in common cold. But in RSV, where the lungs are involved, these symptoms are very, the previous symptoms are very mild, but there are some major symptoms which you can see, which is which are like fast breathing. The child will be breathing faster than normally, and noisy breathing. You can hear wheeze. Wheeze is the expiratory sound, that is high pitch expiratory sound which you can hear. And then there can be chest indrawing. So this is a very major symptom which should be picked up. Chest indrawing means the pulling of the skin around the ribs. If you look at the chest of the child, you can see the ribs. Normally it is not seen, but if there is lower respiratory infection, then the ribs will be visible when the child breathes. And difficulty of feeding will be there, and child will be drowsy, decreased activity, and the fever will be more prolonged, and there will be wet cough, means the cough will have sputum in it whenever the lower respiratory tract infection, whenever the infection is spread below the level of your throat. So RSV is a virus which affects the lower respiratory tract and causes these symptoms. So this is how you are supposed to identify whether my child is having upper respiratory or lower respiratory. And if lower respiratory is involved, then the child will be more sick, more drowsy, and will be lethargic. Look at the child, you can see that there's something wrong with my child. So you go to a doctor and get him evaluated, you can see that the saturation level of the child is also less, and you can hear crepitations when the doctor keeps a stethoscope and hears. So in the lungs there will be findings in RSV. In common cold it will be upper respiratory, so it is what every child gets: runny nose and voice change. These things are seen in the common cold.
Okay, thank you, doctor. This information is really going to help the parents who are watching this live. Before we go any further, I would like to remind all the parents that we are taking questions in this live session. So if you have any queries, please feel free to share them in the chat, and Dr. Nida will answer all of them. So let's move to our next question. How can we boost a baby's immunity in winter?
Okay, so first we have to understand what is immunity. Immunity is the ability of the child to fight infections. So if a child has to fight infections, the child should first understand that this is infection which has come, the pathogen, the attacking organism which has attacked my body, and child has to respond. Whenever the child is born, the babies will not be exposed to any pathogen, so they will not have any exposure to any pathogen, so they will not have that much of immunity as we have. As the years go by, the children will keep getting infections. They will understand, okay, this is a pathogen, this is the organism, this is the germ which is coming to me, I have to fight back. So this, over the years, when the child is growing, will understand and will learn. So that is why children will be getting more infections when they are younger age group. So less than 5 years, getting repeated infections is common. So that is a good thing, as because the child is learning and getting exposed to these infections. So whenever a child is getting this infection, so immunity develops, so that in future if the same pathogen comes, the child will be ready and be responding faster. So how you can boost this immunity building process is by taking care of some general measures. So in general measures, first is you have to avoid infections as much as possible in winter seasons, because avoiding infections can be easier if you follow the few precautions. For example, you have to avoid crowded places, and if the child is going to a preschool, then you should be little careful to see if the children present there are having any respiratory illnesses. Then mask is advised only for children more than 2 years. So less than 2 years, there is no need of mask. It's just avoid the contact, because the respiratory illnesses spread through air, and some of the respiratory viruses, they spread through fomites. Fomites is the general items, like by touching a surface which is already infected by other viruses. So hand hygiene, like washing hands every time you come back from home, and or coming back from crowded area, or using a sanitizer, wearing a mask more than 2 years, avoiding crowded places, taking bath, and sanitary precautions, these things to be done. Regarding keeping self warm, that is also advised. So if you are in the winter season, the cold air predisposes to most of the infections, and if the humidity is also less, at that time infections also affect more. So you have to cover the body accordingly, based on your temperature of the city. So you can cover by the head is more important, because the child's head is having more surface area compared to the rest of the body, and child loses more heat through head. So covering head by caps, and using mittens, socks, sweater, and generally what is told is, the whatever the mother is wearing, suppose mother is wearing 2 layers of clothes, child will be feeling more cold, so you can give one more additional layer, like you can use an undergarment or a thermal for a child extra. So then the child will be wearing 3 layers. So this is how you generally take care. Then you have food. So food is um, the major chunk which boosts your immunity. So in food you are supposed to give good protein. Protein rich diet should be there. Veg, non-veg, based on the diet you can decide. Protein should be there in all the three meals. Minerals and vitamins which are there in fresh vegetables and seeds, and avoid junk food. And breast milk, so breast milk is advised up to 2 years of age. So breast milk contains most of the antibodies which are there in the mother. So as I told you, child is less exposed to pathogens. So if child is less exposed to pathogens, the mother is already exposed to those pathogens because she is an adult. Those antibodies which are there, the fighting capacity which is there in the mother's body, is transferred to the milk, and that is transferred to the baby. So indirectly you're protecting your baby. So it is good that you breastfeed your child up to 2 years of age. Then adequate sleep and rest, and you give sunlight to your child. You take the child outdoors, fully covered, properly covered, fresh air, and exercise. The sunlight should enter your home also, so the room should be well lit. I know in winters it is difficult, but whatever sunlight is available, you open the windows, you so that there is less pollen, less buildup of pathogens inside. And avoid smoking. Smoking triggers majority of respiratory problems in babies. So in any age group, it is dangerous. The second hand smoke, which is inhaled by the children, is very harmful. It can trigger asthma also. And vaccination is another immune building. So immune building procedure. So vaccination up to date, you have to completely immunize a child for pneumococcal, the pentavac in vaccination, and influenza vaccinations. So this is how you can build the immunity of the child.
Okay. So, doctor, our next question is, what are the best preventive measures that parents can take to protect their little ones? I guess you have already
This,
answered that question
yeah.
with the immunity part. So, what food should be avoided in winter?
Okay, I think even that I have covered a little bit. So, in detail, if you want to know, avoid junk food. That is the first thing which I would say. Junk food includes everything which is outside, easily made, and not organic. That is not freshly made. For children, anything which comes in a packet is harmful. So, nothing in a packet, everything is processed. So, you have to bring the raw ingredients, make in home, and feed the child. This is the first thing. Second is, I have seen parents asking, child is sick, can we just give him juice? So fruit juices, freshly made juices can be given. That is, I would rather say fruit pulp to be given than make a juice, so that you are not adding more of sugar. So sugary drinks avoid, and ready made juices, totally no for children. And then yeah, regarding fruits, so in winter they say giving some types of fruits is not good for children. So that actually depends on your own child. So you would have seen your children over the years, and some fruits, like some citrus fruits like oranges and strawberries, kiwi, for some children have allergy to bananas. So these are few allergies which are only specific to few children. If you have seen allergy and problem in your child after giving this fruit, only then you avoid that. In general, I would not say it is this to be avoided, that to be avoided. Okay, the natural food which is available, you would have seen in your child. If it has caused allergy, then you avoid it. Maybe give it after the winter season has passed. Otherwise, there is no harm in giving any kind of fruit or any other thing. Like people say, not give milk, not to give curds. So if there is allergy, only then you are supposed to stop. If there is no allergy, there is no harm in giving fruits or curds. And I said breast milk, that is the best thing you can do for your child.
Okay. So, our next question is, how to manage sinus in toddlers during winters?
Okay, so sinus as in upper respiratory infection. So usually what we have seen is the toddlers will be having upper respiratory runny nose. इसकी नाक तो हमेशा बहती रहती है. So that thing is okay, because runny nose, if it is not causing problem to the child, you don't have to worry. You don't have to treat it. There is no need to treat. You don't have to stop the child from learning to fight infections. Only if it is causing major problems, only then there is requirement of treatment. If it is just runny nose and it is not causing any problem, like it is not causing problem to feed, like breastfeed, not causing problem to whatever playful activity and sleep. So if these three things are okay with your child and there is some runny nose, some here and there cough, it's okay. Because once cough comes, it stays for 1 week or two to totally get resolved. Once there is runny nose, it takes around 5 days. Even we know that it takes 5 days for runny nose to go. So there is no need to treat that. If there is more problematic issues, like I told you, it is causing problem to the child in his daily activities, then you are supposed to go to a doctor, not do anything at home. So problems, if the child is not able to do daily activity, unable to sleep, get evaluated first, because toddler age group, and this age group is very risky. The respiratory airways are very small in the child. If there is some problem, they can deteriorate fast. So self medications at home, very dangerous. The only medication which you can give at home is paracetamol, I would suggest. That also dose to be adjusted based on the child's weight, and that also taking into your pediatrician's advice. So that to be advised, taken properly. Over the counter medications like antihistamines, I have seen cetirizine and many other combinations which are not authentic. So those combinations not to be taken. That is strictly no. And less than 1 year, so there is no role of giving any antihistamine to child. It is strictly contraindicated. Other things what you can do in your home is you can just maintain a fever chart. That will be very useful for your doctor to know if the fever has increased, or it is prolonged, or it is going in an abnormal way, where the doctor can pick up whether it is lower respiratory infection, whether it is getting converted into lower respiratory. So maintain a fever chart. Whenever the child gets fever, you write it down, measure and write it down. At this time, on this date, my child had this much of temperature, and then I gave paracetamol. It subsided after 1 hour, and then next episode happened after another 3 to 4 hours. So that is how you can maintain a fever chart. In this way we can know whether the fever is getting resolved slowly. Then in home, what else we can do is, if there is blocked nose or runny nose, you can use saline drops. So saline drops come in ready-made bottles also, or else you can just make saline, mix a little bit of salt, take a little bit of salt water, and drops of like few drops on each nostrils can be given. This will dry up whatever dried up secretions are there, will become loosed, and it will clear the secretions in the nose, and this is totally safe. It can be used by everyone. And you can ask the child to blow if it is an older child, but usually children are very young, so they will not know how to blow. They will either swallow it off or they'll keep it in their nose. So what you can do is, you can clean the nose with a simple handkerchief, whatever is possible, by just taking it anteriorly, or you can use a bulb suction, but that has to be done carefully, not to be done in small babies. Or you can use a cotton, normal regular cotton itself, make it into a wick, just insert it in the nose and take it out. So whatever is there blocked will come out. The remaining will get wet and go back with your saline drop. So this much you can do for your respiratory runny nose, blocked nose, all this. And hydration is very very important. So whenever we have respiratory illnesses, our body will be losing the water in form of perspiration, and in to moisten the air which they are inhaling. And even by fever also, there will be a lot of dehydration, so you have to hydrate the child again. So it is advised up to 1 to 1.5 liter for this one to 3 years age group, you are supposed to give normally. But when the child is sick, you can add a little more water, like 1 glass extra. Give in sips, give over the period of the day, so that they don't drink more water in just one time. And no fruit juices. And watch for danger signs, like I have explained. There should not be fast breathing, there should not be drowsy, there should not be chest in drawing, there should not be prolonged fever. So these danger signs, keep watching every time. Your child, if develops any of this danger sign, then go to a doctor. You can't manage at home. And adequate rest, staying at home, taking simple meals, wearing light clothes. And when the child is febrile, you're not supposed to cover with blankets. You're supposed to keep the child comfortable in a well ventilated room. And you can change the bed linen daily. You can use a humidifier if available, or just cool air is okay, not air conditioned. Then you can use vapor rubs, menthol, and other things, oils which are there at home. Steam inhalation can be practiced, but it has to be done with care, because there can be steam injuries. And taking a bath actually also helps clear up the nose of the children. So the congestion which is there will get relieved if they just take a body bath with adequate temperature. So home nebulization is dangerous, another thing which is to be kept in mind. So not to be done, no home nebulizations advised.
Okay. So, doctor, our next question is from a parent. Actually, it's from Kiran
Okay.
Preet, who's asking, is it normal for my baby to have cough for a long time during the winter, or should I be concerned?
Okay, can you tell me the age group?
She
What
has not
age?
mentioned the age group, but she has said baby. I guess it should be around like below 3.
Okay. So, prolonged cough, like I told you, whenever there is respiratory infection in less than 3 years age group, the runny nose takes around 1 week to go. The cough takes more than a week, like 7 to 10 days to go. If it is continuing beyond this, if it is just here and there, little bit of cough, dry, and it's not affecting the child, don't have to worry. Just give some time. But if it is wet cough, if it is accompanied with difficulty in breathing, fast breathing, or if there is some indrawing, like I told you, if these danger signs are there, and if it is associated with a wheeze, like initially I told you, if there is a wheeze associated, then you definitely have to go to a doctor and get evaluated. We need a detailed head to toe examination and an auscultatory examination. We will see if there is wheeze, if there is a component of allergy present in the child or not, or if the infection has prolonged, or and secondary bacterial infection has happened, or if there is a pneumonia, then we have to check. So just to see if your child has any danger signs. If there are no danger signs, and if your child looks comfortable walking around, don't worry. Here and there cough a little bit, not to be taken into much consideration.
Okay,
Hope that
thank you so much,
answers.
doctor. So, our next question is, how can I strengthen my toddler's immune system during the winter to prevent respiratory infections? It's from Ritu.
Like I already told you, you don't have to prevent infections. Children will get exposed to everything which is present in the environment around you. They will get exposed, they will learn how to fight, and then they will become all right later. So if your child does not have any major problems, like if your child is not having any chronic lung disease, if there is no immunocompromised status, if there is no problem with other things, any normal child will learn and will be all right. Like if you want to learn to ride a bicycle, you get onto a bike, you fall sometimes, and then you learn not to fall, and then you go over. So there is no need to prevent infections. Children will get infections, but they have to recover fast. So that is what you have to concentrate on. If your child is getting around 6 to 8 infections per year, that is also okay. Less than 5 years. So as soon as your child gets infection, no need to panic. Okay, this is a process. Is understand, like, please understand that this is how your child is growing the immunity, and then you have to see that the infection doesn't prolong and he recovers fast, and stays all right. So for that, like I've already told you, general measures, clothing, avoiding crowded areas, hygiene, avoiding contact. Like if someone has respiratory illness, tell them to stay at their house, don't allow them to your home, or tell them not to come to you can tell the teachers not to allow children who have a respiratory illnesses to the school. And then what you can do is give food, like you are supposed to give protein rich diet, protein, veg proteins, you have paneer, soya, tofu, etc. Non-veg proteins, fish, um, lean meat, and egg is very good. So these things, protein rich diet, and then vitamins and minerals
Okay.
which the child gets by fresh vegetables and seeds, and breast milk. So these things you have to take. Then there is no role for using supplements, there is no role for using multivitamins and all. So there is no role of all these things. Only if the child is deficient, then only to be given. Otherwise these things are not to be advised.
Thank you so much, Doctor. Our next question is from Ashmita, who's asking for some simple steps that she can take to help her toddler feel more comfortable when they have a cold or respiratory infection.
Okay, I think I have answered this, but I will summarize again. So, if toddlers they get cold, you have to see that it is not affecting their daily activities. You give them saline drops, which are very safe. These are available commercially over the counter also, or you can just use salt water. Add few drops to the each nostril. It will, whatever dried up crusting is there in the nose will get loosened and it will come out, or else whatever secretions are there inside thick one will get loosened and it will go to their throat if they don't know to sneeze it out. Then you can suction the snout if you have a bulb syringe. If you don't know to use, please don't try at home. You can just use a cotton and make a wick out of it, clear the nose, whatever is possible from the anterior part. Give a warm bath to your child. Give fever medications as per your doctor's advice. No antihistamines, and hydrate the child well. And you can use a propped up position for the children. That can be done, like if you lie make the child lie flat on the bed, maybe it can cause blockage. So if you make the child head and elevated by using maybe a pillow or a wedge shaped pillow, or two pillows with a blanket pillow to the so that the child's head is elevated to maybe 20 to 30 degrees, that will also give some relief to the child. And yeah, small simple meals, that should be done, that should be okay.
Okay. So our next question is from Niharika, who's asking, are there any specific vaccinations like flu shot and RSV vaccine that I should consider for my toddler during winter?
Okay, so vaccinations in India, we have vaccinations under National Immunization Schedule. National Immunization Schedule is the government sponsored vaccines, so which is must and compulsory to all the children in India, and it is given free of cost. And all the ASHA workers, they come, they take care that no child is missing any of this shot. So these are very major illnesses, if at all missed, can cause severe diseases in children. So that's why government is sponsoring and is giving it free of cost. So among this, what you have is pneumococcal, which is streptococcus pneumonia. It causes pneumonia to lung infection, and also it can cause brain infection. It can also cause problems to your brain, to the child's brain. So this is also given free of cost. So this is in government schedule, it is given at 6 weeks and 14 weeks. So if you are taking following a proper schedule, government schedule, then you would have received, the child would have received this. And another thing is the hemophilus influenza, which is a component of a pentavac injection, which is also given free of cost by government. So that also child would have received at 6, 10, 14 weeks. So these two things government is sponsoring, because this causes major chunk of severe serious infections in children. But there are other things like flu shot and RSV. So this is not covered by the government. For this, you have to go to a private doctor. So for this, we have guidelines from Indian Academy of Pediatrics. So I will tell about influenza, which is advocated by in IAP also. So first dose for influenza. Influenza actually has two types of vaccines: inactivated and live vaccine. So one type of vaccine is where the virus is inactivated and it is used. The virus is not alive there. Another one is the live vaccine. So you can take either of it. The efficacy is almost similar, but there are some contraindications to live vaccines. So based on your child's eligibility, it will be decided by your doctor. So what you can do is influenza vaccine. According to the schedule, you're supposed to immunize your child at 6 months of age. First dose, that is at 6 months. Then the second dose will be after 4 weeks. So these two things in 6 months. So after 4 weeks would be 7 months. So 6 months, 7 month, you take the vaccine. After that, every year you take one vaccine, one dose of influenza booster. So priming 2 doses, and then influenza 2 doses, influenza 1 dose booster every year annually. According to IAP, we tell that up to 5 years it is must to take, but you can take after 5 years also. We advocate and we tell parents to take up to 5 years at least. After five, they can take if they are at risk. So this is how it is done, and it is 0.5 ml, and it is given intramuscular. The live vaccine is given by nostrils, so like it is injected like an nasal drops. So live vaccines are having some contraindications that cannot be taken by every child, but inactivated can be taken by everyone. It will be a injection. So this is how you have to take. And influenza vaccine will give you protection up to 6 to 8 months. After that, because influenza virus will keep changing every year, the composition of the influenza virus will keep changing every year. That is why new types of vaccines keep coming, new strains they keep coming. If you know, if you've read the news articles and all, there'll be strains. So either northern hemisphere or southern hemisphere, the globe is divided into northern and southern hemisphere. Based on that, new vaccine strain come every year, and every year a new flu shot as a booster to be taken by the children. And it is also advised to other risk groups, high risk group adults. For example, like it is also advised to be given in pregnancy. In pregnancy, it can be taken anywhere after second trimester, and maybe at least 36 weeks. Yeah, up to 36 weeks it can be taken. 12 weeks to 36 weeks, anytime the mother can take one single shot of flu vaccine. Then the mother will develop the immune antibodies in her system, and that will be passed through the placenta to the child, and that will protect the child after birth up to 6 months. So because you're not giving influenza vaccine less than 6 months, so that child will be exposed to influenza virus. So that protection the child can receive when the mother was pregnant, and if she has received this flu vaccine, so this immunity will be passed on to the child. So pregnancy is one, you are advised to take that. Or if you're going on an international trip, or you're planning to visit any crowded area like some mela or something, then also you can take. Or if you are known to have an asthma, if an adult is having asthma, then also it is advised. Then chronic kidney disease patients, chronic liver disease patients, and these patients are advised to take influenza vaccines. This is compulsory. Yeah. And regarding RSV, so RSV is not actually available in India, RSV vaccine. So RSV, we give in influenza, we give virus and we ask the body to make antibodies and learn. That is what we do. But in RSV, we actually give antibodies to the individual whom we are vaccinating. It is
Okay.
uh, it is like a monoclonal antibody is injected into the child. So this is still not available in India, but in foreign countries like in America and UK, it is available, and it is advised to give in preterm babies and in chronic lung disease, that is BPD babies who have a problem in their lungs and they require oxygen for longer time. These babies will be more prone to get RSV infection. So for them, this prophylaxis is given, RSV prophylaxis. So we will be giving these monoclonal antibodies to them, and that is also covering up to 2 to 3 months. But this is not still available in India.
Okay, thank you so much, doctor. So we are moving towards the end of this live session. And before we end it, I would like you to summarize the whole session.
Okay, so in this session, what we learned today was to identify respiratory illnesses, whether they are upper respiratory or lower respiratory. Anything above your throat level, above, is upper respiratory, which is usually mild and will not cause any problem to your child. Your child will be walking around and will be having some fever, and it will subside on its own because your child is normal and has a good immune system. And lower respiratory, whenever the infection has gone down below, at that time there can be noisy breathing and there can be chest indrawing. These are the danger signs which you are supposed to look for. And anytime this comes to your, any one of this comes to your child, you have to rush to a doctor. Having difficulty in breathing, fast breathing, like breathing more. Usually, they say in 1 to 3 years age group, it should be less than 40. So, child should be breathing less than 40 times per minute. If the respiratory rate is more than that, if the child is having abnormal sounds like a wheeze is a high pitched, slow sound, expiratory sound, like this you will be hearing when the child is breathing. And if there is a stridor means there is a sound in the throat you can hear, and there will be child will be very toxic looking, will not be normal when you look at. And then if there is chest indrawing, so these are the danger signs. And child is not feeding, not eating, is drowsy, these danger signs if they develop, better to go to a doctor. So this, if it is picked up fast and the child is transported to a proper hospital, most of the problems will be solved. Otherwise, when the child is just having upper respiratory illnesses, uh, parents, please be calm. There is no need to rush, and no need to take go visit multiple doctors and take multiple, or just take over the counter medications, give antihistamines. There is no need to treat each and every cough, each and every runny nose, because that the child is building its immunity, and you're coming in like it is, if it is not causing problem to the child, there is no need to treat it. Then next, what we learned was how to build immunity. Immunity to be built by preventing excessive infections, by avoiding crowded areas, keeping children and adults who are already affected away at least for 5 days, because flu, before the symptoms start, the child will be exposed. The child will be infected 1 day before or 5 days later. So this is the time when the infection can be spread to others. So at this time, stay indoors and then take good nutrition. Nutrition include proteins, vitamins, and minerals, and breastfeeding up to 2 years, and then hydration. Hydrate well. What to do at home? You can give fever medications, give humidified air, suction out the snout, avoid unnecessary junk food, and keep watching for danger signs. Then you have to immunize your child. Immunize according to national immunization schedule if you are preferring government, or if you want to take extra vaccines, then you can go for IAP schedule, which also includes influenza vaccine. Influenza vaccine after 6 months of age, 2 doses for first year, whatever year you are starting. Suppose if a child has entered 1 year of age, like it has crossed 1 year, and then you're starting influenza vaccine now, first time you give two vaccines, 2 doses 1 month apart. Then after that, every season you give this vaccine just before the rainy or winter seasons. Like for example, second booster, first year the child has received two vaccines. The next year, in the second year of the child will be eligible to take influenza vaccine 1 month prior to rainy season or 1 month prior to winter season, whatever is there in your state that you have to follow. So usually it is given in April or it is given in October season, October, so that the child is ready for the coming thing. And also, whatever influenza vaccine you give, it is not 100% preventing the disease. It will prevent the severe diseases. Whatever severe disease was supposed to come to your child will be very mild, like a runny nose, and it will go off. So it is not 100%. So even after taking flu shot, why did my child get influenza? That is answered by my explanation. Then what you can do is, if there is secondhand smoke, then totally avoid it, because that is something which you can for sure do for your child. So if you're smoking, please quit. Then yeah, that should be it. So so
So, doctor, we have some time left, and there are some more questions. So, we'll try to answer them very quickly. The first question is, can I pass down throat infection to my baby during breastfeeding? It's from Shraddha.
okay, so as I told you, breastfeeding is never contraindicated in general conditions. At least if the mother has HIV, it is not contraindicated. So why it is so is because the child is still naive. The immune system is not exposed. They are not ready to produce so much of antibodies. They are still young. At that time, God has made this special thing in the mother so that whatever immunity she has, whatever good things she has learned over all of her years of exposure to pathogens, all her illnesses, every good thing, all the antibodies, fighting capacity, everything comes to the breast milk, and through the breast milk, you're giving it to the baby. Like, to explain it in further detail, I will tell you that when mother and baby both are, suppose they go out, they mother catches infection first. You see that the mother is having runny nose. So now, as soon as the symptoms develop to the mother, you know that the child was also exposed to that same infection. It has still not developed the cold and cough, just that much, but the pathogen is already there in both of them. Now at this stage, if the mother and child is separated, at that time the child is left alone to fight the disease. But if the mother is also there with the child and is continuously breastfeeding, the mother's immunity, which is strong and has already produced antibodies, those antibodies will travel through the breast milk and go to the child and will protect the baby more. So that is why you can observe that whenever like if you have two children and you can compare them, the older sibling will be getting more respiratory infections, more illnesses. But if the child is less than 6 months, you don't see much of symptoms in them. That is because you will be exclusively breastfeeding, and all the immunity from you, all the good things from you is going to the child, and the child is protected, the baby is protected less than 6 months. So whenever you have infections, what you can do is, first you can treat yourself, hydrate yourself well, wash your hands, wear a mask, handle the baby like you normally do, breastfeed normally. There is no need to wash your breast also, because it does not travel, the virus does not travel through your breast milk. It travels through your mouth, nose, and your hands. And if this is touching the baby's nose or mouth, only then it travels to the baby. The infection does not travel through your breast milk. Only the antibodies which are protective to the baby travels through the breast milk. So it is advisable to keep the baby close to you and continue feeding during this time.
So, thank you so much, Dr. Nida. We are coming to the end of this live. And before we end it, I would want to tell you that we have more questions from the parents, which we will
Okay.
share with you. to get them answered so that the parents can come and check them out. So thank you so
Yeah,
much.
well, that would do. Okay, thank you.